Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about Fallots tetralogy. Fallots tetralogy is the most common cyanotic congenital heart disease. It is a cyanotic congenital heart disease which occurs in newborns. It is characterized by four features, which is pulmonary stenosis, ventricular septal defect, overriding of aorta, as well as right ventricular hypertrophy. These are the four tetralogy of the Fallot. These four causes, which is known as tetralogy, and it is Fallots tetralogy. It is a congenital, it is inborn. Pathology. Since the right ventricular pressure is more than the left ventricular pressure due to pulmonary stenosis, the blood is shunted to right to the left through the ventricular septal defect, which leads to the central cyanosis and squanting episode, increases the systemic atrial resistance, hence reduced shunt from the right to the left ventricle. Due to the pulmonary stenosis and the ventricular septal defect, the blood is shunted from the right to the left. Due to this, there is central cyanosis occurs. The squanting episode increases the systemic atrial resistance. The squanting increases the systemic atrial resistance, hence it reduces the shunt from the right to the left ventricle. The clinical features of this tetralogy of Fallot are usually it occurs in the children. It is asymptomatic at birth. The children with the Fallot tetralogy may present with dyspnea and fatigue. Growth usually they are retarded. Exercise leads to the systemic vascular resistance. Due to the exercise, there is systemic vascular resistance. This increases the shunting of the blood from right to left ventricle, leading to the increased cyanosis as well as syncope. Due to exercise, the ventricular vascular resistance is created, systemic vascular resistance is created, so that the exercise, crying, feeding can also causes cyanotic spell, can causes increased cyanosis and syncope. Due to this, it may lead to the sudden death and can occur during the cyanotic spell. The polycythemia as well as clubbing occur due to the chronic hypoxemia, which results in thrombocytopenic stroke. The investigation of this Fallots tetralogy are in chest X-ray. It looks like boot-shaped heart. This shape results in hypertrophy of right ventricle and coupled with a small left ventricle. The ECG occurs with the right ventricular hypertrophy. The ECG shows clearly the right ventricular hypertrophy as well as the right ventricular deviation. In echocardiograph, it shows overriding of the aorta. Cardiac catheterization is done due to the patient of operative treatment, or the patient with the coronary circulation needs to be verified, where the coronary circulation needs to be verified, or to the operative treatment, this cardiac catheterization is done. Now the complication. The complication are intravascular thrombosis and thrombocytopenic strokes can occur. Brain abscess can occur because of the organism entering the right ventricle by the venous return and can enter the systemic circulation through the ventricular septal defect and reaches the brain. Higher incidence of pulmonary tuberculosis is there. Infective endocarditis. These are the complications of the Fallots tetralogy. The treatment are complete surgical repair, consist of closure of the ventricular septal defect and relief of the pulmonary stenosis. Due to any surgical repair, there might be closure of the ventricular septal defect and the relief of the pulmonary stenosis. These are the treatment. Occasionally, palliative procedures like anastomosis between the subclavian artery as well as pulmonary artery is done. Antibiotic prophylaxis for endocarditis is done. These are the treatment of this Fallots tetralogy. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do like and subscribe my YouTube channel. Thank you.